Hi, my name is Joshua Freitas with the National Institute for Dementia Education, and today is NIDE Talks. I have a special guest here today, Dr. Jeremy, which I'm very excited about. I've worked with him in the past. A lot of his work revolves around social isolation, but being a college professor and so much more, I really want to jump in with him and pick his brain today and share some knowledge with all of y'all. So, Jeremy, would you mind just sharing who you are, where you come from, what you're doing right now, and what your area of focus is?
Absolutely. And thank you so much for having me here, Josh. I am so excited. I'm from Ohio and currently in North Dakota, also doing a lot of work as a full-time professor in New Mexico Highlands University. And there is a lot that I've been doing with the intergenerational program that I was fortunate to found. It's called To Legacy. And I'm also doing a lot as a speaker and an instructor.
That's fantastic. What is the thing that you're most passionate about for your field of study?
Right now, I'm really passionate about social connection. I'm really passionate about how important it actually is, especially in this age of technological advances. In technological advances, it's great, but we need to still keep intact that social connection, human connection, because we are still going to be human as far as as long as we want to be, right? And so it's important to keep that intact.
For sure. And what are some of the themes that you're seeing? I know AI is coming out, so I shouldn't share this, but I will, is that my kids say my best friends is Alexa and Siri. So with that, as I know that connections will happen there, but do you see AI as an opportunity to kind of improve that connection with even from human to human?
I see it in two sides. One, it's a great opportunity to be more socially connected. The other is we actually have to train AI in how to be more human and how to treat every person like an individual and how to learn as far as really understanding humanity and appreciating different people from different backgrounds. And that's ongoing. It's not going to be something where, all right, AI has enough information now. Now it could just go on autopilot. There's going to be different generations with different kinds of values, systems, cultures. And I think that AI really has to be trained by humans to be the best kind of partner for humans.
I love that. And with the literature and the research out there, do you see any correlation between healthy aging and socialization or cognitive decline with being well connected?
Absolutely. Because we actually saw during the pandemic how social isolation and loneliness started to and affected older adults in a really serious way. Many older adults were dying, and it was inadvertently due to social isolation and loneliness, and it was affecting their mental health and well-being. We need that social connection, and the mental health is it's an opportunity for us to look into the lens of how is my social connection right now, because there are correlations between our mental wellness and the social connections, the ties that we have. We're not meant to be here alone in a silo. We're meant to have impact. And actually, there's a lot of meaning that comes into being socially connected with others from different backgrounds that have different perspectives.
I love that. And in thinking of the neuroscience of having meaning and purpose, it really shapes the brain. So, Jeremy, if you were to like prescribe to somebody kind of the first steps to get out of that comfort zone to start socializing for seniors, what kind of first steps would you share to prescribe to them?
We need to destroy ageism. And the way to do that is to introduce geriatrics like in the third grade, maybe even earlier, because aging well shouldn't be introduced at the age of 65. Aging well should be introduced somewhere along the lines of 2 years old, three. We should be on a trajectory of aging well, and it should be introduced as a normal thing, as a thing that is great, as a thing that we can celebrate, because that's the point. All of us are, that's where we want to go. We want to go into healthy aging, every single one of us, so that when we do get older, it would be easier for us to engage with others with different backgrounds, different age groups, but the younger people will easily be able to engage with an older adult because they understand these people are part of my community. Because right now, there's little subtle things that communicate to people that older adults are a different species or something. We have to destroy that. They're not. We're all human beings and we all really need each other.
Do you believe that there's a stigma to aging and that we don't teach it young enough? Do you think that that stigma keeps people from embracing the aging process?
Absolutely. Just the absence of the subject teaches a lot of things. So, just the absence of an older adult in the community or an older adult's insight in the curriculum is teaching too much. And we need to, a lot of times, it's what's missing in our curriculum that we need to really take a look at. For older adults have such insight, such wisdom, and but all we see is stigmas, like you said. There's a lot of things that negatively reinforce silos that really shouldn't exist in our society.
I love that you're pushing that forward because I feel like a lot of kids often don't see that. And for my field of work too, I think in assisted living, I think we should really be pushing our programming team to do intergenerational programs to break that stigma because we all contribute to life. If you had to talk to younger versions of people, how would you recommend to them to kind of break that stigma, to jump out, to create connections? And I know Legacy does that with connecting people, so you can definitely work that in too. But what kind of things would you say to younger generations to break that stigma? What are some footsteps for them to take?
So one of them is we really need to introduce the fact that it's okay to not know everything in a conversation. So for example, if something new is introduced, one of the things we train our students in when they meet with an older adult is that if you don't know about a subject or if you don't know something about their life, that's a good thing. You can ask more questions. A lot of times the natural tendency is to say, "Oh, I don't know about this, so I'm going to go into a subject that I really know something about." And the reason why people do that is because of a lot of things, but imposter syndrome is one of them too. We need to show that we know so many things instead of showing our humanity that we don't know everything, and that's why we need each other. And so that's why I'm excited to really engage with you and learn all these different things. Oh, you're a different age group? You're from a different age group than me? Whoa, what was that like? There's actually a lot that I can engage and learn. So, like you said, in our intergenerational program, there's an opportunity there for people just to engage. And here's the one big thing: we don't engage to try to diagnose anybody, or we don't engage to give someone some kind of this is what you need to do. We engage because we care about their story. We care about them. We want to reinforce their value, their story, what matters to them. And what matters to them is what matters to them. No one in healthcare can dictate what matters to someone, but we can listen.
I love it. You bring up such rich context because curiosity neurologically is so powerful, and you kind of create this vortex where the younger person is having neuroplasticity shaping the brain to understand, and then for that senior that's disengaged, you have neurogenesis that is sparking those past conversations and re-engaging and bringing them together. So I think that's a really rich way to bring society forward. I'm going to ask you more of a personal question. What do you fear about aging? And it could be anything from how society views it, or what are your big fear points of aging?
So, how I feel personally about the subject of aging or myself aging.
Yourself aging.
So, yeah, I one of the things that really motivate me is pay attention to how I eat because I really want to make sure that I have the capability to do the things that I think are important, the things that really matter to me. And thank you for asking me that question. And I think each of us, each person listening and watching can ask themselves the same question because then you kind of take a look and see, oh, dang, what really matters to me and what should I be really focused on right now? Because the thing about aging is that time runs out, right? We begin with the end in mind, and we're thinking about, okay, why am I wanting to stay healthy, right? That's one of the things that motivates me. Oh, because I want to spend time with my family. Well, what do I want to do with my family? Maybe I want to do as much meaningful things as I can. But the other thing is I have goals. I really want to help some goals get accomplished. And then how am I going to treat people then if I have those goals? How can I best take care of myself socially, emotionally, and physically and culturally too?
I love that. Do you see, just from your research and the literature out there, is socialization directly tied to longevity, or I should say, quality of life and longevity? Of do you find that people that stay more social longer have better quality of lives in general?
Yes. So one of the things that I love is the blue zones. The blue zones is the areas for your listeners, the areas in which there's a lot of centennials, a lot of people aging beyond the age of 100. So one of the greatest things that they noticed is that there is a lot of there's a lot of community and social engagement, but it's not just social engagement, just not engaging with people. It's meaningful social engagement with people that matter to you. So when you're engaged with people and doing what matters. And that word, those two words, what matters, is very important. Early in age, we should teach each other to embrace the things that really matter to us as often as possible, because there's a close tie between people engaging in what matters and the trajectory of their life, living long, healthy lives together is really there are very close ties there.
Hey, Jeremy, have you heard of the term lifestyle medicine, or the branch of medicine called lifestyle medicine?
Ooh, tell me more.
So they have a whole association now about lifestyle medicine, and one of them is socialization. So it's about sleep, but socialization is one of those key aspects to actually improve quality of life and just kind of all
Mm.
the different changes that happen in the body neurologically. So it's kind of cool. I'm kind of diving into lifestyle medicine quite a bit lately. But this is actually one of their pillars, and I think it's so powerful that that is your focus is decreasing social isolation by getting people to connect. And I think it's much bigger than just socializing, like you said. What kind of initiatives do you have that listeners could help support? Do you have any projects going on now, or anything that you think people should look at or they should research themselves to help push kind of your mission forward?
Absolutely. So, Grandparents' Day, I'm releasing a book called The Social Determinants of Health Toolkit. The thing about the Social Determinants of Health Toolkit book is it's teaching, and really the big focus is to break the silos. So, a lot of times people, their health declines because of social isolation and loneliness inadvertently, but it has a big effect. And so, why does this happen? Well, sometimes there's subjects and topics that people really need to talk through and talk about. And when they don't, those get, those create a breach between relationships. And relationships can cause stress. And the lack of relationships can cause stress, right? I'm thinking of them too, Josh, right? We're all thinking of those relationships right now, right? And but the point is that we need to stay socially connected. But a lot of times there's subjects, and the social determinants of health all have different subjects in them that really are determinants of one's health and well-being that need to be constantly looked at and addressed, and we can't do it alone. That's the problem. Like, I can't handle all of these alone, but the book is going to help people walk through each of those determinants.
That's fantastic. What is the actual date of release or the month, just so people can? I'm excited to actually read it. So what month does it come out in?
So it's Grandparents' Day. That's September 7th,
Okay.
2025. Perhaps while people are listening to this, it may already be out, but it's Grandparents' Day 2025.
That is fantastic. Well, can you kind of walk us through now? I don't mean to pivot, but I'm excited to hear more about the book. Can you give us some of the insights that are in that book without giving too much away? But what would they gain from reading that book?
One of the most important things is that just like a plant needs soil to grow, we need social connection. It's the social determinants of health. We need to be connected with others, and those determinants have very specific areas in which we can nourish our life for longevity. And so the important thing is to take a look at those and to have a goal setting aspect of an approach for every single one of those determinants. A lot of times when we see a presentation or we see some materials on the social determinants of health, they use determinants in a negative way, like they talk, these are the determinants that are going to lead to these ailments. But actually, determinant is it's an indifferent word. It's an objective word. It could be a determinant this way or that way. So what we're focusing on in the book is the determinants that are going to lead to better outcomes for each and every one of those categories.
I love that. I feel like it's breaking the stigma, which is I feel like a huge mission for you. Is but you also bring up a good thing too. Is our perspective on the word choices we use, or etymology, or psychology of wording. Is do you feel like there's an opportunity for us to rephrase or reframe some of the wording that we use around aging?
Yes. Yes, indeed. Let me start with a couple. One is, well, PTSD. PTSD is actually, that could be any age, but but we have a lot of veterans, right? And they're also of any age, but there's a lot of older adult veterans that I think are important. And what I use, I've changed the acronym personally to mean a place to share and to digest emotionally,
I love
because
that.
yeah, when we recognize a moment that we're like, oh man, I feel triggered by this, that means I need a space where I can really digest this, right? So that it can be, so I can use it for my life and for humanity in the most constructive way ever. So that's one. I think another term is soft skills. I think that I don't use the word soft skills. I don't say anything to anybody if they do, but I use humane skills because that's what they are, soft skills. If I was to say, which one do you want? Do you want to use the hard skills or would you like soft skills? Like I so I say, well, we need the hard skills. Well, actually, we need humane skills because I don't know about you, but I love superhero movies. And a good villain is someone with they have amazing IQ, but Josh, they have horrible EQ. Horrible EQ, like no EQ actually. And the heroes are the ones, they may not have all of the IQ, but they have the EQ, Josh. The EQ is incredibly important. So the reason why I'm saying that is because the humane skills that's the EQ. That's what makes us heroes, is the humane skills. And so I use humane skills for that reason. And there's a few other terms that I think we need to just revisit and really make sure that we're using it in the most effective way.
I agree. And actually, I just had this thought last week. I'm not sure how it fits or how it comes out, but the word healthier, I have a little bit of a problem with because it's never ending. So, healthier is kind of never getting there. So, I was even thinking last week, like, how do you replace the word healthier? And I was thinking, like, stronger or progress, because I think you're constantly getting stronger, either stronger emotionally or stronger physically. Instead of saying healthier all the time, I feel like you never achieve that. But I think words are really powerful when you bring that stuff up.
I'll say I really like that. I really like that. I like stronger because it correlates a lot with resiliency, right? I'm getting stronger physically. I'm getting stronger this way and that way. That really promotes, I think, resiliency. Healthier is like, okay, what is that? Like, am I eating better? Am I eating, put more avocado in my life? Like, what is that?
Yeah.
But when it's like, I'm getting stronger. Ooh, I'm getting stronger. And that actually goes across all ages, right? So that's
I,
beautiful. I like that.
So, Jeremy, catching up recently, you were sharing some of the integrative kind of processes of taking your curriculum and really embedding it into other kind of disciplines. What other kind of disciplines are you kind of looking at for people to adopt this or put it into their practice?
We really need to streamline the screening process when it comes to older adults and all patients. Because I've had providers come to me and say, yeah, I get these results from these screenings, but I don't know what should I do with them. I don't know what to recommend them, et cetera. And I don't blame them for not knowing. And you're already focused on helping so many patients. So we're training case managers, and as we know, case managers can be social workers. They can also be trained nurses. And what we're doing is utilizing our curriculum to, as intentionally as possible, engage with older adults, helping them to be healthy at home and also helping them to have more doctor visits as opposed to emergency room visits. And so we have a platform that's going to really help embed a lot of things, embed the screening process, embed the coding, because oftentimes healthcare systems they're doing a lot of care, but they're not actually getting the pay that they could be getting from coding that they can be really bringing into Medicare, Medicaid process. So one of the things that we help out with is embedding the training with the coding and also the screening and really synthesizing all that, bringing it together. And also, we're watching the different metrics that are going to help healthcare systems be compliant. And we're really excited about it, and it's going to help make a lot of difference.
I think you really hit the head on that though, because allied healthcare, I think a lot of times we don't always think about social workers and RNs and all the people along the system. And so I think it's really great to get people the education, plus knowing the aging population that's coming up. A lot of allied professionals are going to take that abundance of the work and the need. So I love that type of stuff. What can you paint a little bit more of a picture what that looks like? Would that be some like online training? Would it be some education they can sign up for? What would that kind of look like for them? I know you have all the research and stuff put together for the training, but what does it look like for the end user?
Absolutely. So what would happen is there would be a healthcare system that brings us on. We have a nurse practitioner. The nurse practitioner will be the coordinator that really walks their case managers through the whole process. So the case managers would start and meet with the older adult, but they would be utilizing our trainings that really have age-friendly approach in it, and it also has the social determinants of health in it. So there's a lot that we're going to have in the training, but it's not just the training. Just like you said, we're going to have a coordinator, a nurse practitioner that's going to walk them through it. So if they have any questions, because I'm a big fan of vulnerability, that giving a case manager the opportunity to say, hey, how do you do this? Or hey, did I miss this? Or what's something I can do with this? Or even community health workers as well, and helping them as they work through the process. Because I don't know if well, I think you know this, Josh, but a lot of times social workers don't have a curriculum, right? They're just coming in, and also case managers, they know what to do, but they don't really have like there's not really a program, and they come in and they do the best with what they have and everything. What we're providing is that full support and an organic, flexible program. So it's not a program that's just going to walk you through here, 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 because that's not the way health works. That's not the way healthcare works. The case manager is going to work with the nurse practitioner through a series of processes, and it's going to be something that they're going to have something that's burnout proof as well, because a lot of times it's the professional caregivers that a lot of times feel isolated and alone. We're providing that as well, and we're including that support.
I love that. And you already know I think very highly of you, but when I think of a researcher that is a practitioner that puts things into place, you're doing everything there. You're doing social work, writing a book, educating students. So I just want to say kudos. But I also wanted to say, have you ever thought about writing a kid's book to help break the stigma for kids to view older adults as contributors? I'm just curious.
I haven't, but that would be awesome. I thought about books to write that reflect my own children and what they mean to me and everything. But I would love to write. I think it'd be so cool to write a book from all age. I think it'd be cool to write a book for in elementary school, also junior high and high school. And because it's all beautiful. The way that someone of that age meets with an older adult, it's different and but it's beautiful. It's like a different rose or a different flower. It's so yeah. I thank you, Josh. You're giving me another project. I think I'll have to add that one to the list.
Bring it on to change society. So, Jeremy, now you got me excited about a kid's book. Can you tell us kind of more of what that would look like? I know I'm putting you on the spot. And then also kind of where that could go for more education to bridge that gap between generations.
You know, it'd be really cool. It would be really cool if if the kids book was a kid, maybe a kid in elementary school or in junior high or in high school, going about the day of an older adult. And we're going through the book, we're saying, oh, that's interesting. There's a kid living like they're an older adult. That's really interesting. But at the last page, you see that that kid is actually an older adult. Because an older adult doesn't see themselves as oftentimes as this older adult, this old person. They see themselves the way that they've always seen themselves, right? And I think they want people to see them the way that they see them, the most noble and dignified way that they see themselves. So I think that would be a really cool idea for a book, and I think that's something that's going to be up the pipeline.
And then, if what if you had to go beyond the book? What kind of other tools or national awarenesses could you think of to create a better understanding of our older population?
I think, Josh, there should be a national awareness day, right, of older adults, of healthy aging or of aging in general. And perhaps that could look like a student really going through the day as an older adult. And maybe that would encompass a lot of things. I want to say that not every older adult has like a certain disability or something. But as we age, those things are possible. And for someone that maybe they have not the same eyesight that they had before. So there could be an opportunity for them to, maybe put on some kind of glasses or something that wouldn't, that would be safe. That would just help them have a moment of understanding what it could be like not having all of the capacities of a 14-year-old, right? And just seeing what that would actually look like and what would you have to think about as you navigate through that.
And I feel like it would be fascinating to see, like, I know dementia simulations are pretty big in memory care where you get into the shoes of somebody with dementia, you have goggles and gloves and to really experience it. But I'm wondering if we could almost do that for students in school where they are maybe their vision or having to remember a walker or those type of things. But I think that'd be creating quite awareness, which we'll have to talk about offline and kind of figure out how to get that in motion. That'd be really cool.
Yeah.
Jeremy, if you had to leave everybody today with some words of wisdom from you, maybe kind of something that you would see on social media with your photo and a quote from you, what would that be?
Well, compassion and um, I would say that compassion and civility need to be a way of life, a way of everyday life. Civility is looking at others from their lens and their background and their perspective and navigating through life that way, not through who's doing something good, bad, right, wrong, better, or worse. There's a place for that. But in human experiences, most of the time, we need to interact really from understanding that other person's perspective, values, their story, understanding their story, because it helps us have greater compassion. And that's what we're talking about, even with the National Day. Like the goal of having a National Awareness Day, something like that, is that people would have better compassion for humanity, for others, for people of different backgrounds, different experiences. We need more compassion. So if someone says, "Hey, can we bring out the lights here a little bit more? I'm having problems seeing." Won't be like, we won't have a negative reaction to that. We'll say, "Absolutely, man. Let's see what we can do here," because we're all going through this experience together, Josh. We're doing this together.
Well, thank you so much, Jeremy, for coming on. And also the fact that you humanize such a thing and bring it to the forefront for people to understand and break those silos. And your life work, teaching, educating, future goals is, I just want to thank you because you are making a better future for our seniors that are getting older. So I want to say thank you for coming on. And also thank you, everybody, for listening. And before we go, is Jeremy, if somebody wanted to reach out to you and find out more, learn more, or had questions, what would be the best way for them to get in touch with you?
Yes, you can go to jeremyholloway.com. You can also email me at Jeremy, Jeremy, Holloway, Holloway, at Telegacy. That's Tellegacy.com. And let's connect. We must stay connected. I think it would be great. So just say hi. Lunch.
That's amazing. And thank you, Jeremy, so much. And if you like today's content, please share it with a friend or a fact. But most importantly, please take the knowledge and put it into practice. Once again, my name's Josh with the National Institute for Dementia Education here on NIDE Talks. Thank you, Jeremy, for joining us. And I hope that you all have an amazing day.
Thanks, Josh.